life, liberty, and the pursuit of happiness. These are all examples of unalienable rights set forth by the Declaration of Independence. However, one question still remains clear, and that is whether or not our right to live includes our right to die. I believe the answer is yes. I came to this conclusion after extensive research on the topic. Euthanasia is the painless killing of a patient who suffers from an incurable and painful disease. Through my analysis questions, I found out that most people do know what euthanasia is, and that they say its practice depends greatly upon the circumstances involved. Over the next couple minutes, I will review the following things: what it is and the different forms, the current laws surrounding it, and a few of the top arguments. First, let's begin with what exactly euthanasia is. As stated before, euthanasia is a painless killing of a patient who suffers from an incurable and painful disease. There are a few different forms of euthanasia, including non-voluntary, involuntary, and voluntary. Involuntary consists of passive and active, and there is also something called physician-assisted suicide. Throughout the next couple minutes, I'll be focusing on the different forms of voluntary and physician-assisted suicide. Passive euthanasia, which is the death caused by the deliberate withdrawal or withholding of critical medical care. For example, if a doctor takes out a person's life support tube or takes out their breathing tube, this is considered passive euthanasia. It's widely accepted around the world. Active euthanasia is the deliberate action by a medical professional to end a patient's life. Physician-assisted suicide is when a physician gives the patient the means to end their own life. An example of this would be a patient receiving a lethal dose of pain medicine from their physician, and they self-administer it. Remembering the differences in these three forms is important in understanding the laws which surround them. Passive, for example, is legal in all U.S. states. However, physician-assisted suicide is only legal in 4, including Montana, which it's by trial, Oregon, Vermont, and Washington. Active euthanasia is illegal in all 50 U.S. states and is only legal in 3 countries throughout the world, including Belgium, Luxembourg, and the Netherlands. It is, of course, because these laws involve something as precious as a human life that they each are surrounded by their own sets of guidelines and restrictions. Oregon, for example, a patient must have a diagnosis of a terminal disease with 6 months or less to live by 2 separate physicians. They must make 3 different requests for euthanasia within 15 days apart of each other. 2 must be verbal and 1 needs to be written. They have to be 18 years or older. The euthanasia itself must be self-administered. They have to be deemed capable of making their own decisions, and they also have to be notified of any other options that are available. Many different arguments surround this controversial topic, and one of the big ones is the right to life. A person's right to die is as fundamental as their right to life. As written in the editorial, A Time to Die, by The Economist, think of a person's life in biographical rather than biological terms, in terms of achievements, experiences, responsibilities, discharged, and so on, not in terms of blips on a hospital scanner. It then becomes clear when a person's life has been completed. When a person or his relatives can see that a biography is finished, it is not up to a physician to try to write an extra painful chapter. Being forced into a life that a person believes is insufferable is not only cruel, but a horrendous violation of their right to live and die as they please. A next argument is called the slippery slope. It is said that legalizing one form will lead to more permissiveness regarding the practice altogether. An example of this would be the Netherlands, which legalized euthanasia in 2002. First, the restrictions started off as a patient needing to be terminally ill. However, over the years, it has grew broader to include things such as terminally ill, chronically ill, psychologically ill, and then even children. There's no denying that the restrictions in the Netherlands have become more permissive. However, the slippery slope argument rests on the assumption that these new instances are all morally wrong. As a quote from Dr. Bentar, a member of the philosophy department at the University of Cape Town, the suffering a person endures need not be the product of a terminal disease in order for it to be intolerable. Mental suffering, which can be as hard to deal with and as insufferable as physical pain. Everyone, regardless of their mental capacity, age, or other factors, can suffer from a life not worth living. So logically, this leads to euthanasia being more permissive and the restrictions becoming a broader in range. The last argument is the abuse of the system. This argument dictates that if euthanasia is legalized, it will be abused, and no restrictions will be able to stop this abuse from happening. Working on this logic, however, driving should be illegal. This is a fundamental right given to us that is abused every day and even results in countless fatalities every single year. No restrictions that we have work completely to prevent the abuse. Some people speed, disobey traffic signals, and even drive while intoxicated. Dr. Bentor once wrote, "The problem with that argument is that citing many examples of abuse is not sufficient to justify the withholding of that right." A study performed in 1998 on the practice of euthanasia in the U.S. found that over interviewing 355 different oncologists, 5% have admitted to performing euthanasia, and another 5% have admitted to performing physician-assisted suicide. So this just shows that euthanasia is happening in the U.S. and that the real question is not whether or not for it to be legalized, whether or not it is happening, but whether or not we want to set restrictions on it. In conclusion, euthanasia and our right to die with dignity and how we please is something that needs to be upheld completely. I urge you to take this knowledge that you have learned today and spread awareness about this topic and the benefits that it can have.